Hello, and welcome everybody. My name is Samantha Dinsdale, and today I will be sharing on the public health issue of refugees lacking menstrual supplies and private safe toilets. The prompt statement here that I would like to share with everyone today is Myanmarese and Syrian refugee women and young girls suffer from period poverty. Period poverty is when there's a limited access or no access at all to sanitary pads or other menstrual supplies, as well as inadequate washrooms or just in general a clean, safe environment for those who menstruate to properly take care of this menstrual hygiene. Some health indicators that are important to note here for period poverty are awareness of menstruation before one's first period, which is typically around 12 to 13 years of age. Obviously, there's some difference in some women and young girls. There's also the use of menstrual material. Some people, like I said, do not have access or it can be very expensive and unaffordable. And as well as access to a private place to change and wash at home. As I said before, often there are not safe or clean locations for women and those who menstruate to properly handle their menstrual hygiene management. So it would be really important to hopefully change those issues as depicted in this graphic on the right-hand side to hopefully improve this public health issue. I wanted to take the time here to relate period poverty on various levels. It's really important to look at period poverty from a holistic approach, and the socio-ecological model really allows us to do that. So when you look further into this diagram, you can see there's several different levels, starting with the individual at the center, and then it branches out all the way into policy. When looking at each level, you can see there's a different color scheme here. Anything that's written in darker would actually help the public health issue versus anything in red hinders it. For example, looking at the organizational level, something that would really help combat period poverty are free menstruation supplies within schools. Yet something that really hinders it is bullying. And bullying in regard to peers or professors and so forth that really try to make those who menstruate feel shameful or prevent them from using the washrooms to just perform basic menstruation hygiene management. So those are a couple of examples here, but I think this does a really good job relating period poverty as an entire entity instead of just looking at it at one person. So to combat period poverty, there's been several different ways for evidence-based practice to occur. For example, one study that was found provided sanitary pads and or menstrual education to hopefully increase attendance in young girls and those who menstruate. Unfortunately, those who menstruate often have a reduced likelihood of attending school due to that bullying that I just shared briefly with you all, as well as prevention of using washrooms. Some teachers do in fact prevent those who menstruate from utilizing the bathroom, which often can continue and perpetuate the bullying that is seen. Thus, this study was able to provide sanitary pads and or menstrual education or no intervention at all. And when applying both types of intervention to a group of students, it actually increased their likelihood to attend school. Another intervention we could consider here today is providing reproductive health education in conjunction or alone with sanitary pads to adolescents who menstruate. This study took a different approach looking at reproductive health outcomes and education with the same goal of limiting period poverty. This specific intervention aims to bridge the gap in the limited number of interventions for period poverty and was successful in showing that providing either one or both types of those interventions compared to a control group with zero intervention actually improved the reproductive health outcomes of those who menstruate. And this third intervention that I think is a little bit outside of the box is a toolkit. It was actually created originally to help refugee Myanmarese and Syrians who menstruate and is hopefully implemented within low and middle income nations through the use of organizations. It's a resource that's located online, it's free access to it, it's able to be printed and so forth, and it provides a guideline to how to help period poverty. So there's information on there such as WASH programs and other ways to improve hygiene infrastructure within a location, as well as different resources for menstrual education, reproductive health education, and sanitary pad distribution. So all three different types of interventions could be evaluated in 4 different measures. The first could be the overall process. So how well was our priority population reached? How many information sessions did we hold if we're providing education? And how many organizations have used this resource or toolkit? The next two types of evaluations, the short-term and medium-term, really focus more on the specific knowledge or attainment that's learned from these interventions, such as, has there been an increase in understanding about sanitary pad or menstrual hygiene management and use? Are more people attending school, those who menstruate? Or is there an increased likelihood of them to do so? Those specific types of questions could be examined using like a pre or post survey and or a questionnaire that could provide better insight to, before intervention, this is how the priority population felt, and this is how they feel afterwards. It would provide really good information for us. And our long-term goals are more systemic changes that we're looking to hopefully change here, such as feelings of shame or stigma around menstruation, bridging a gap in the limited number of intervention services, and increasing the number of private hygiene facilities. These can be evaluated, again, using either a questionnaire for the first one or two, but the last two interventions could do a literature search to see if there's any more information, or conduct a survey when it comes to different income nations to see the number of facilities that have hopefully increased in the long term. Like any intervention, unfortunately there's always challenges, but I have some really innovative solutions to hopefully overcome them. The first challenge that I see here is access to a safe space. The safe space would be an environment where it's able to provide the education and the sanitary pads and other provisions to the priority population. In order to combat that, I think it would be really great if we formed relationships with community members and maybe female organizations or those who menstruate organizations to create strong partnerships, make everyone feel safe and comfortable to talk about such an uncomfortable conversation that often is seen in many cultures. Another potential challenge could be interest from the priority population. Due to that social stigma and that shame and stress often felt by those who menstruate, I think it would be best maybe if we could communicate openly and honestly about these interventions and how they would benefit those who menstruate. Another potential challenge could be the lower literacy levels amongst our priority population. Since we're looking to intervene in some low and middle income nations, it's important to keep in mind that they may not have a similar education level as others, so I think it would be best if we explained all of the content in layman's terms and utilized graphics. I think the graphics would be a great example seen within sanitary pad use, so that similar information could be passed along to other community members or friends and family of those who attended our intervention. The last issue, as seen with many public health interventions, is the lack of funding. So this hopefully could be combated by applying for local and federal grants, or hopefully receiving some lovely donations in the effort to help combat period poverty. This last model right here is termed a logic model, and it helps us better understand in public health terms the resources and interventions, so what really goes into this program, what activities we would perform, the goals that we're hoping to see, and our outcomes. So within our outcomes, we're looking to see hopefully change by a certain percentage over X amount of time. So for example, within 2 years, increase the likelihood of young girls attending school during menstruation by 30%. So that would be a really important goal, especially since those who menstruate, unfortunately, have a decreased likelihood of attending school, as mentioned earlier, and that's a big hopeful change that we're trying to evoke here, especially with one of the types of intervention. But overall, we're trying to have long-term impacts such as decreasing shame and stress felt by those who menstruate, bridging the gap in the limited number of interventions for menstrual hygiene management, and hopefully increasing the prevalence of private and safe hygiene facilities for women and young girls to be able to care for themselves, especially during menstruation. So those are my references for all of these lovely information that I've shared with you all today. And I just wanted to thank you all for listening and taking into consideration this really important public health issue. It's really unfortunate that so many refugees and other people who menstruate lack menstrual supplies and private safe toilets. So hopefully some of these interventions that I've shared with you all today could hopefully be implemented into the communities that need it most. So thank you all and have a wonderful day.